What if I want to change health insurance plans, change employers, change health insurance plans after 65? Is that going to be a problem? I may also decide just to go on Medicare. I'm tired of doing this and doing that, and I'm not sure that this new plan is all that great. So what if I want to change from group insurance to Medicare? All right. Well, this comes up from time to time, and especially folks who have maybe some kind of ongoing pre-existing condition. That really complicates things. But this is Bob Vineyard, your Medicare expert with the Georgia Medicare Minute. Okay, I have a friend who has been on his wife. He's over 65, and he's been on his wife's coverage, group insurance coverage, and he's been offered a job, he says, that has just great benefits and much better benefits than what he's had. And he wants to know, well, should I take advantage of that? Of course, I don't know how long this job's going to last, or should I just go ahead and go on Medicare? It's not an easy answer to address. It's further complicated by the fact that he recently has had a diagnosis that's going to require some fairly immediate surgery and probably ongoing treatment. Okay, transitioning from his wife's plan. Now this is March. We're in March now. Transitioning from his wife's plan to a new employer plan is not going to be a problem as far as the pre-existing is concerned. Group insurance plans are going to look, have you had creditable coverage? Yes, I have. Okay. The bigger challenge is, and he's had other medical issues this year, the bigger challenge is that, all right, he's 3 months into the year, and he has, I don't know if he's satisfied his deductible yet or not, but he's certainly accumulated enough claims that most or all of it has been satisfied. Changing over to a group insurance plan means he's going to start over with whatever new deductible his new health insurance plan has. So even though the benefits may be great, he may have to come out of pocket essentially double what he's already paid in. He's going to go through 2 deductibles essentially by going that route. And so it may not be all to his advantage. A better choice would be, and again, he's past 65, a better choice would be to go off of his wife's group insurance plan and go on to Medicare and start there. He's still going to have to prove that he's had creditable coverage since he's turning 65 in order to be able to enroll in Medicare and get on a supplement plan. But again, if he can do all that, prove his creditable coverage and get enrolled in Medicare, then he'll be fine, because even though he'll have a new deductible under Medicare, this year, with the plan he's looking, the Medicare plan, supplement plan he's looking at taking, he's only going to have to satisfy $200. Because everything else would be covered, no out-of-pocket between Medicare and the supplement plan. So it's one of those things that, wow, I'm finally going to get good group insurance, but it may cost him, again, several $1,000s to do that. It's a tricky type of thing. And unfortunately, people look at it, they don't really look at it completely. They say, well, this new coverage, I'm not going to have to pay anything for it. But if I go on Medicare, I'm going to have to pay for that. Well, you're going to pay for it one way or the other. You're either going to pay premiums to Medicare to have lower out-of-pocket and be able to continue seeing the doctors that you have been seeing, or you can pay nothing for the new employer group insurance plan and have to start all over with a new deductible. May be able to keep your doctors, you may not be able to. So like I said, it's just not an easy thing to, it's not an easy thing. There's not a cut and dry yes or no, this is what you should do type of thing. But if you have questions about this, give me a call. This is Bob Vineyard, your Medicare expert with the Georgia Medicare Minute. You take care. Have a great day.